Colon cancer is the third most frequent type of cancer among men and the fourth among women in Brazil, with an incidence of death of approximately 14,000 cases per year, according to data from the National Cancer Institute. In most cases, there are no symptoms until the disease spreads throughout the body. However, some warning signs may indicate the need to see a doctor for additional tests. In this video, we will show you the 10 main early warning signs of colon cancer, also known as bowel cancer. So stay until the end, as one of them might surprise you. Let's get started. Sign 10. Anemia. This condition is characterized by a lack of healthy red blood cells or hemoglobin, cells responsible for transporting oxygen to the body's tissues. This symptom is common in colon cancer because intestinal bleeding can occur without any sign in the rectum or stool. If you are experiencing fatigue, shortness of breath, or dizziness, this could be due to anemia caused by colon cancer. In this case, it is important to see a doctor for additional tests, especially if it is accompanied by other symptoms from the list. Sign 9. Changes in bowel habits. If you are experiencing persistent changes in bowel movements, this could be an early warning sign of colon cancer. Examples include constipation, diarrhea, changes in bowel movement frequency, incomplete evacuations, and a decrease in stool thickness. These abnormal bowel changes can be caused by a variety of factors, such as changes in diet, inflammatory foods, and bacterial or viral infections. However, if they last for more than a few days, it is better to see a doctor to determine the cause. Sign 8. Nausea and vomiting. Symptoms of nausea and vomiting are also indicative of colon cancer. Cancer cells can release substances that affect the digestion and absorption of food. Additionally, a tumor in the rectum can obstruct the intestines, leading to the accumulation of waste and toxins in the body. This can cause unpleasant symptoms as the body tries to rid itself of these substances. If you are experiencing persistent nausea and vomiting along with other signs and symptoms, it is important to see a doctor to rule out the possibility of colon cancer. Sign 7. Loss of appetite. Cancer cells can release substances that alter the way the body processes food, leading to a loss of appetite. This is a common symptom in cancer patients, including those with colon cancer. Researchers have found that these symptoms are associated with metabolic changes and reduced food intake, and can occur during the early and late stages of the disease. The sooner the symptom is noticed, the better. Loss of appetite can lead to malnutrition, which can negatively affect overall health. Sign 6. Unexplained weight loss. Unintentional weight loss is a warning sign of several types of cancer, including colon cancer. It can occur due to persistent diarrhea or difficulty digesting and absorbing nutrients. Additionally, if a colon cancer patient is experiencing loss of appetite, it is natural for them to also have unexplained weight loss, as these two symptoms are generally related. Sign 5. Blood in the stool. This is one of the most common early warning signs of colon cancer. If you notice bright red blood in your stool, this indicates bleeding in the lower intestinal tract or rectum. You may also notice darker stools, which could be a sign of upper gastrointestinal tract bleeding. Although blood in the stool can be caused by other conditions, such as hemorrhoids or anal fissures, it is important to see a doctor to rule out serious causes. Sign 4. Diarrhea. Diarrhea is defined as stools occurring more than 3 times a day, and is a common symptom of conditions such as food poisoning or stomach viruses, but it can also be an early sign of colon cancer. While diarrhea is not an immediate concern, it is important to see a doctor if it lasts more than a few days, or is accompanied by other symptoms from this list. Sign 3. Pelvic pain. In fact, pelvic pain is not an early warning sign of colon cancer, but pain in the pelvic region can indicate that cancer cells have spread from the intestines to the pelvic region. This is a serious condition that requires immediate medical attention. Therefore, it is especially important to be aware of these symptoms if you have had intestinal problems in the past. Before telling you the last 2 warning signs of colon cancer, let me remind you that you can leave a like on our video if you are enjoying the content. Your like is very important to us and it costs nothing, so leave it there. Also, subscribe to our channel to not miss all our health tips and activate notifications. Colon cancer warning sign number 2. Abdominal pain. This is a common symptom of many conditions, but it can also be an early sign of colon cancer. When cancerous tumors grow in the colon, they can obstruct the intestines and cause the accumulation of gases and waste, leading to abdominal pain, bloating, cramps, and swelling. In some cases, The pain can be severe enough to warrant a visit to the emergency room. The last colon cancer warning sign on our list is *** chronic fatigue ***. This is an evident sign of several types of cancer, including colon cancer. In fact, researchers have found that fatigue occurs in about 80% of colorectal cancer patients, and 30% of patients experience chronic fatigue, especially those receiving chemotherapy. Additionally, colon cancer often results in malnutrition and weight loss, both of which can contribute to fatigue. If you are feeling unusual fatigue, it is important to see a doctor to help determine the cause. Understanding the signs and symptoms of colon cancer is essential because early diagnosis can lead to more successful treatment options. To quickly recap, the first warning signs you should be aware of include blood in the stool, changes in bowel habits, anemia, loss of appetite, unexplained weight loss, nausea and vomiting, diarrhea, abdominal pain, chronic fatigue, and pelvic pain. If you experience any of these symptoms, schedule an appointment with your doctor to be checked, as the sooner you identify any changes in your body, the better your chances of recovery. If you want to support our channel, leave your like, share this video with your friends, and subscribe to not miss any new videos. Now there should be some other useful videos appearing on your screen that I am sure you will like. Just click on one of them to continue here with us. Remember that we are not doctors, and this video is only informative to help you with prevention. Thank you very much for watching until here. See you in the next video.